this computer. Okay, welcome everybody. I'm Dottie Kuntz this is the Vancouver, Washington IONS Community Group. And our speaker tonight is Cindy Stoddard of Clear Mind Vitality here in Vancouver. She's going to talk to us about neurofeedback, achieving optimal brain function. Neurofeedback's been around for over 60 years and uses advanced computer technology to train and tune the brain to treat a number of brain disorders, I guess you'd call them. Cindy's going to tell us all about it. She's a neurofeedback provider. She's been a coach for a number of years using different technologies, and this is one that she's been using for a few years now. So I'm going to turn it over to Cindy Stoddard. Welcome, Cindy.
Thank you, Dottie. It's nice to be here. It's nice to see all of you. So to start with, I want to make the distinction between a QEEG recording, which is actually used both as a diagnostic tool, and a QEEG recording that we use to work with neurofeedback. So neurofeedback actually started before we had what we call mind maps or QEEGs. And it's actually the first person that recorded electricity in the brain. I'm going to look in my book real quick. Was Hans Berger in 1924. So quite a while ago. He's from Germany, and he was the first person to record electricity on the scalp. And then Herbert Jasper was able to develop a study of which parts of the brain are doing which processes. So certain parts of the brain are used mostly for auditory, certain parts are used more for emotional areas, and certain for visual areas. So he developed what's called the 10-20, which is something we still use today. So what we do is we start out we get what's called a mind map. Can you all see this? So we put this cap, it's kind of like a swimmer's cap with a bunch of cords out the back of it. And it has these little white channels. And I fill each of these channels, which are open, with some gel. And then this is connected to my computer. And I also clip this on the ear with some gel. So there's a clip on each ear. This goes on the head. And then we check those channels. We check and make sure that every one of those little channels is working properly, and that we can read that information from that part of the brain. And I would say if you're considering doing neurofeedback, one of the things to look into is, does the person providing it have a team of experts? Are they working on their own individually, or are they working with doctors and specialists? Because it's very complicated. Getting the map isn't so complicated, and running a session isn't that complicated, but choosing protocols and making decisions about which direction to go next can be very complicated. So finding someone who's working with a team of experts is really important. So I want to share a screen with you and show you, let's see, where's my arrow? Oh. Is it working? Might be way over there. I've got two screens hooked up in my office, and I have to have an arrow big enough for me to go see from a TV on the other side of the room. So, okay, I'm going to just share with you this image. So as I don't know how well you can see this, but this is showing what's called a bipolar montage. We're either doing 1 channel, 2 channels, or 4 channels. And my arrow now is pointing to the left ear. There's a clip on this ear, a clip on the right ear. A lead at the point of CZ and a lead at the ground. And then this information is fed into the computer. This is showing a 2-channel lead. So we're doing a C3 and C4. By the way, this strip along here, and I'll talk more about this later, this is called the sensory motor resonance, or SMR strip. It's just, if you put your hand just above each ear and then go up an inch and then touch the fingers on top, this area along the top of the head is called the sensory motor resonance. And it's been a really, really important part of neurofeedback and how we're helping people. So I'm going to jump out. So basically, once we get, let me go and show you, let's see. Where have I got? Yeah, that's not what I need. Oh, here we go. Okay. So once we get a map and we can see what's happening in the brain, it gives us this information. So
Cindy,
this is
it's a white screen.
Oh, is it?
Mhm.
Oh, let's see, I need to just go. Okay, I'm going to stop share and then share again. There we go. Can you see that?
Yep.
Okay. So the information we get here, this will give you an idea of the information we get after we get a map. This first dial right here is looking at how much brain injury this person has experienced. So if they're a TBI, traumatic brain injury patient, this will show us how much damage the brain has experienced. This next dial, which is labeled inhibited, is showing us how much depression this person is experiencing. And the third dial, over-arousal, is showing us how much anxiety this person is experiencing. So more than anything else I've learned from or experienced, I realized with my 2.5 years in neurofeedback, I realized that anxiety and depression are brain chemistry. The brain is working in a certain way that's setting people up either to have depression or anxiety. And when someone is experiencing anxiety for too long, the brain will actually push them from anxiety into depression to protect the brain, because anxiety, with all the chemicals involved in that, with cortisol and adrenaline, all the cocktail that is created when people feel anxiety is really toxic to the brain. So they'll actually be thrown into depression to protect their brain for short spurts of time. So when we're pulling them out of anxiety or out of depression, we have to back them through anxiety. And what I tell my clients is, you might feel some anxiety as we move in the direction of your getting out of this, but it's not going to be that long. Generally speaking, it's a week or two, and then you'll be back to your normal state. So this part of the diagram, which is called local neurogenic and psychogenic. When we're working with someone, we ask them to take 3 surveys. And the surveys are asking questions about physiology, about emotional experiences, what they're experiencing emotionally, and it's asking questions about their physical symptoms. And we look at that score and decide whether or not they're a good candidate for neurofeedback, because if they're too ill or their score is too high, their body will allocate resources for a higher priority than the neurofeedback brain reprogramming. And it would be a waste of their time and money if we try and do neurofeedback when they're really sick. But when they get better and their score drops and they're a little healthier, then we can get started. So CEC is representing this client's survey. EEG is looking at what we found when we did the mind map. It's telling us what information we gained from this mind map. So this mind map is telling me that this person is experiencing impulsivity, socially inappropriate. That doesn't necessarily mean that this client is socially inappropriate, but their normal inhibition that would kind of prevent them from acting out is not as effective as it could be. This person will be easily distracted. She might talk more than she wants to, hyper emotional. So all of these things give us a sense of what she's challenged with. These things under psychogenic are issues that do not show up in the mind map. And so if she was coming to me to work on specifically these particular issues, I would refer her to a therapist to work on those issues. But all these on the neurogenic are things that we can work to support her using neurofeedback. And so this is just the kind of the shorthand version. I want to kind of go quickly through the other parts of this. So executive processing, memory, math comprehension, visual processing, verbal processing, visual processing, reading comprehension. We go into great detail. We get a ton of information about what is and is not working well in this particular brain in this time when we did the recording. So she may not think of herself as having trouble with short-term visual memory or figure memory or facial decoding, but her brain could work more effectively and it be improved in that. So when somebody tells me, you know, I have trouble remembering faces, then I know, okay, yeah, that's something we can work with. And I know a particular part in the brain where we will be working, placing leads for that person. So this is showing me the gray lines are all the normal rates. So we're working with the bands of delta, theta, alpha, beta, and I'll explain in another slide what each of those are used for. So she's a little high in eyes closed in delta, a little low in theta, alpha, and beta. She's quite low in the central. This is the frontal, this is the central region, this is parietal, and this is occipital. And then we can look at eyes open, what's happening with her brain and eyes when we do an eyes open recording. We can also look at, this will give you a little deeper picture into what's happening. So we get all kinds of information about where the problems are. So she's having trouble with sleeping because she's high delta. She has chronic issues, chronically sleep deprived, which is something that neurofeedback can be really helpful with. When we switch from eyes closed to eyes open, you'll see her beta rises and we can look at that and decide, okay, what's going on with her that we need to support her with. Anyway, we're going to jump to another couple of slides to give you a little bit deeper picture on what we're working with. I think we did one. Okay. So this will give you an idea. Let's see. I wonder if I can open that up bigger. Can you see this very well? Is that big enough? So we're recording 19 sites. And these are the labels of those 19 sites. And this is a recording of the brain for 1 minute.
Cindy, I can't see a recording of the brain. All I can see is the titles, the chapter titles.
Oh, you don't see squiggly lines?
Mm-mm.
Oh, okay. I'm sorry. I probably didn't stop and reshare. Okay. My mistake. Is that better?
Yeah, now we can see it.
Okay. So this is actual brain trend lines. And it might be interesting for you to know, we have such incredible software and equipment now. It's really important that you get and that you're working with someone that has a newer generation of equipment. This particular equipment, so this is a representation of somebody when they blinked their eye. And if you look at this, you'll see F1, F2, F3, partly F3, and then again down here in F7, and again in FZ, which is the middle of the brain. All of those are representing the eye blinking, and that's what we call artifact. When we're getting a recording for the brain, we want to get the actual electricity of the brain, and artifact is anything else. So it's an eye blink, it's movement, it's a heartbeat, and the software that I'm using will take this artifact out. So that will take that out, and that's not going to affect my recording and my response to this brain's mind map, because this software knows that's not what the brain is doing. It's just an eye blinking. But so this is more of a normal trend line. And you can see every brain is unique. Every brain. Okay, this is showing muscle tension. So if I see this really erratic, kind of spiky trend lines, this person is really tense. And we might just do a bunch of SMR. Again, the part of the top of the brain, which will calm the brain down so we can get a more accurate reading for them. Okay, I'm going to jump out of this. And we're going to go into, let's see. I'm going to go over here because I want you to see, let's see. This one. So just to back up a little bit. So your session for neurofeedback would start with getting a mind map. There are people that are doing neurofeedback and they're not using a mind map. And they might just be doing SMRs. That's really just to calm the brain down. It can be really effective, but if they're doing other sites, I would be uncomfortable unless they have the actual information about what's really happening in your brain. An interesting story is when they first started recording the electricity in the brain. They had some fighter. My mouth is not talking. They had some pilots working with the Air Force that were having a seizure response to the jet fuel. And so they thought, okay, we need to do some research. What resources do we have to do research to figure this problem out? And they said, well, so-and-so's got some cats. And they said, okay, go grab the cats. We need to do some research and figure out how to solve this problem. So they started working with the cats. This is a sad story, but they found that the cats, there were some of the cats that they exposed to jet fuel that did not have seizures. And they started thinking, well, why is that? Why are some of them not reacting with a seizure? And they talked with the person they got the cats from. And those particular cats had been doing neurofeedback with them. And specifically, he'd been doing SMR feedback, sensory motor resonance neurofeedback. So they realized that SMR can be a helpful way to help humans with seizures. And they started working with clients or patients that were having seizures. And they were able to completely eliminate or reduce seizures in humans by 50% using SMR neurofeedback. So I'm going to jump through this because there's a part of this I want to show you. Okay. It's really the very bottom of this chapter. Okay, you've seen some of this with the different dials. This particular...
Cindy, all we're seeing is the chapter titles.
Oh, okay. I will go out and back in.
Yeah,
I'm not sharing screen very well.
Yeah, I don't know what that is.
I think when I move too much, it's not following me, but I'm not sure. How's that?
Got it.
Working? Okay, so this is actually comparing two different mind maps from two different times. You can see this is a 329. And I think the first one, I guess they haven't put the date of the first one on. Anyway, these two first rows are looking at the magnitude. So there's several different parts of neurofeedback that we're looking at when we look at a mind map. When we're looking at magnitude, we're looking at which of the bandwidths out of delta, theta, alpha, beta are the highest, is a simpler way to explain that. So when you look at this row and comparing it to this row, you'll see that this row was a light blue and now it's green.
Is that good?
That's really good. We want to get everything back to green. We don't ever do that because nobody's perfect. We never get anybody back to perfect, but we work to get them as close as possible. You can see that theta is about the same. But alpha is tremendously better. So all of this red on the first map is now green for alpha. I'm sorry, that's alpha. And beta is radically better. So all of this red in the first map is now green in the beta bandwidth. Another thing we look at is dominant frequency, and you can see theta is much better in the second one. Red here, green here. Alpha was light blue. So blue is representing slow. Green is where we want to see, that's normal, and red is fast. So we've sped up the blue, which was slow in alpha, and it's now normalized here. In coherence, we see that now this person is more hypercoherent in the second map, but in delta, there's more coherence than we want here. But in theta, they're much better. Alpha is the same, and beta is much better. So what would happen after we get this second map? It's going to give us another list of protocols to run for this client. And then we'll respond to how the brain has changed to probably bring down this alpha and deal with the delta. We're also looking at asymmetry, and what we're working towards with asymmetry is we want to see the right side of alpha all red and the left side of beta red. So this alpha is representing depression. And when we get someone to all red on the right side, they're not feeling as much depression. When we get a client to all red on the left side, they're feeling less anxiety. So we can see from a map what their mood is and their particular state is. So let's take a break for a minute, and I'm wondering if you have questions. I've kind of gone through a lot of information really quickly. What themes? Yeah. Ron, can you mute yourself?
Yes. What I'm curious about is that you talk about the different states that were achieved based on those little colored dots, and you changed something in the protocols. What kinds of things in layman's language are changing? What are you doing to make those changes take place?
So when we're doing a session, the people are choosing something to watch on TV. So they choose something to watch, and we'll hook up a lead, maybe F3, F4, we'll hook up a lead, we'll put a clip on. And when their brain is working optimally, they can watch the show. But if it's not working as well as we'd like to see it working, the screen will go gray. Then the brain will start responding to that. It will start trying different combinations of frequencies, and when it arrives at a pattern that we want it to use, the screen comes back and they can see the picture again.
How do you affect the brain to make it change its frequencies?
It does it automatically. Oh. It's like if you want a child, you're trying to teach a child to ride a bike. They're not thinking, I need to use my left ankle muscle in a particular way or my right leg in a certain way. They just know they want to stay upright and go forward, right?
So it's just the motivation on the individual to watch the TV that then, as soon as they see a gray screen, the brain just kind of takes over and makes little changes without them really being aware of it.
Yeah. So you as a client would see a little bit of graying, but you're not consciously doing what will bring the color back or the brightness back. Your brain is figuring out how to do that. So we are challenging the brain to try new things and rewarding it. And basically we're exercising the brain. And so the screen may go gray 100 times in a session. You know, it's here, it's gone, it's here, it's gone. And with that repetitive practice of trying new things, the brain will find a new habit. So we're not taking anything away. We're just saying, why don't you try this? And as it tries that new bandwidth, that new pattern, and realizes, oh, that's working well for me, now it can operate with that as well. It has a new option. So, for example, one of the things I love most about this job is working with youth. Because I know my work has the potential of changing their entire life. So I'll have kids come in who have impulse control issues. And I can tell they have that if I look at their map and I see higher than normal in the prefrontal area in theta. They do not have normal impulse control. And so they basically don't have the tools to make good choices. They're going to be getting in fights. They're going to be stealing things. They're going to be, making bad choices with alcohol and drugs just because of the brain chemistry. But with a couple of months, maybe two and a half or 3 months of doing neurofeedback and retraining their minds based on their map, I've had parents tell me, I don't know what you've done, but this is like a different kid. They'll say, she used to come in and we couldn't reason with her. She would just start crying and run in her room. And I said, well, that's because the part of her brain that's responsible for language isn't working well. So she's trying to both understand what you're saying and find the words to respond, but it's not working well. It's not balanced well. So she's just disengaging and leaving the room. But with neurofeedback, they said now what she's doing is if there's a problem or she's frustrated, she'll come to us and talk about it. She'll negotiate with us. We come to an agreement. She sticks to it. They said, this is like a different kid. And it is like a different kid because she's now got a normal brain to work with. So it's sad to me. I wish we had a neurofeedback tech in every middle school and every facility that's dealing with kids that have been in trouble. It is, in a lot of ways, it's not their fault. We know from brain trauma when somebody hits their head hard enough with concussions, it can damage the brain and change impulse control. So, it's just sad to me that we're not using this more to help kids. But, I also am working with people that have had strokes, have issue with balance. We can retrain the brain so it can sleep again. Sometimes the brain loses its ability to fall asleep and sleep and get into a deeper state of sleep. So we can do sessions that are specifically aimed at improving sleep for people. And that's like a godsend to people, right? Just to be able to fall asleep and not lay there for 2 hours. Like, where is the off switch? I just need to go to sleep. So yeah. Okay. Did that answer your question? I don't know if that.
Yes, it did. Thank you. Yeah, I just wanted that specific understanding of what was changing in the environment that caused the results you were looking for.
Mm-hmm.
Speaking
Okay.
of sleep, since you've got me, a lot of people who are aging, my mother is one of them, who's having trouble sleeping. She just can't get to sleep at night and just doesn't rest well. A good day is a day where she had a good 4 hours worth of sleep.
Oh, wow.
And so is this kind of therapy useful for that?
Mm-hmm.
Is this kind of therapy covered by, good insurance companies if you talk to
It might be. You could look in her wherever she's at. You could have her talk with her insurance provider. Some insurance companies are covering it, so she might get some support with it.
And would it be a neurologist that she would see to check into this?
I would have her talk with the person she would schedule an appointment with, because they'll be able to look at her plan and let her know whether or not neurofeedback is included in her particular insurance plan.
Well, this topic's been brought up a lot with her primary care physician, and medications and all other kinds of things are being talked about, but certainly none of this.
And, I will get calls from people that are medication resistant. So when they've tried something for depression or they've tried something for anxiety, but have no positive results from it, they'll often hear from the nurse practitioner, well, you might consider neurofeedback. And I'm thinking, why are they not suggesting that in the beginning, right? Why don't we start out with neurofeedback, which has no side effects, and see if that will work before you start prescribing a medication, which probably has quite a few side effects. But yeah, I think Kaiser, I don't know specifically which insurances are covering it, but I think many of them are starting to. So you might have them check her specific insurance plan to see if it's covered. I know Kaiser's not covering it in Vancouver area. I've had clients that have been trying to get them to go for that, and they haven't done that yet. So
Thank you. I don't want to dominate, so thank you very much.
that's good. Thank you for your question. Okay. Yes,
Victoria?
Dennis.
Oh,
Can you hear me?
Yes,
Oh, now what about ADD?
good question. Now, ADD, it turns out, is very complicated. I actually have my oldest daughter's ADD. Typically what we see with ADD is really high delta. So when we're working with someone with ADD or ADHD, we're working to balance delta. Just to give you a short understanding of what each of the bandwidths do. Delta is what we sleep in. So when people are high delta during the waking hours, really hard to focus, hard to learn things, hard to remember things, hard to live life with delta dominating. So when we balance that, one girl who did neurofeedback I said, what's different now? And she said, I'm smarter. Because her experience is her brain is working, her test scores go up, she's just doing better. So do we help people with ADHD, ADHD? Absolutely. Absolutely. We're balancing, and they start sleeping better. They generally start sleeping better. Any other questions, Dennis?
No, I think that, well, so anyway, it can be helpful.
Oh yeah, absolutely.
So what other therapies are useful?
For ADHD?
What other symptoms are improved with the use of this feedback?
Okay, good question.
What are your success stories?
So we work with people with the vet. There have been a lot of vets that have been involved in neurofeedback for PTSD. So I don't know if any of you have heard of the book, The Body Keeps a Score. You got that? Bessel van der Kolk. He has an entire chapter in there about neurofeedback, and he says in his book, there is nothing out there that is more effective than neurofeedback at dealing with PTSD, anxiety, and depression. And if this was something that pharma could make money on, everybody would know about it. So it's effective with PTSD, ADHD, ADD, anxiety, depression, seizures, sleep issues. We can help people with OCD. It's hard to get them in, which reminds me, we have new technology that now allows people to do sessions at home. So you can lease equipment and do neurofeedback sessions in your home. People have to come into my office to get a mind map. So we have to do a mind map in my office, but you can lease equipment, take it home for a month. It saves you money. You don't have to drive back and forth. You can do it at your convenience and in your home at your own time. And then what happens when you do those sessions is I will monitor that in my office. And so I can notice what's happening. Is it working? Is it not working? And I can make adjustments on your protocol. And we get all kinds of information about how effective the session was, what's going on with your mood. You know, I'll talk with people and I'll see they're getting into anxiety, and I'll say, okay, I'm seeing you moving from depression into anxiety. So just kind of watch it. Let me know how you're doing. This is temporary. You're going to get through this. It's just part of the process. It's okay. And I will suggest to them, people can do this easier if they'll add L-theanine. I don't know if many of you have heard of L-theanine. L-theanine, you might be more familiar with GABA, G-A-B-A. GABA is a component of L-theanine. L-theanine is what our brains produce to manage anxiety. It just calms the brain down. It can be used. It might be helpful for those of you, or your mother, Dennis. I think you mentioned your mother has trouble sleeping. Taking L-theanine just before sleep can help calm down the mind. Kind of like magnesium, only maybe they both work together really well. Get some magnesium and get some L-theanine. Will help you sleep better and deeper at night. So as I was saying, it can help with OCD. We have trouble getting people into the office, but if they're willing to come in for a map and then lease equipment, that usually works better for them.
Cindy, what do you tell people when they come in, and do they have to do something, or do you just see what's happening? And
so if I will talk with them about what neurofeedback is and explain what we do and how we're doing it. And this is a really good question, Victoria, because we're literally rebuilding brain cells and connections. When we have several studies showing an MRI before neurofeedback and another MRI after neurofeedback, and we can see that brain has repaired. It's built new brain cells. There's more healthy brain than when they started out before the neurofeedback. But to do that, people need to work with me. So rather than going to a doctor and a doctor gives you a medication that keeps you from feeling a symptom, we're literally rebuilding cells and connections. So for that to work well, people need to get good sleep to the extent they can. They need to have a fairly good diet. They need to have plenty of water. Water is really important for the brain to do what it's doing and to do the work we're asking it to do. So it's a whole body process. And I'll refer people to functional medicine practitioners so that they have someone recommending dietary changes if they need information about that. This is looking at the whole body and how do we help the body work better rather than just masking a symptom. We're backing up what's gone wrong. In fact, it's kind of strange. With someone who's got a lot of anxiety, we will do SMR, and people with research have found that you can reduce the anxiety and get people sleeping better working here. You can also back them back into anxiety. So you need to be careful about who you're working with. Are they experienced? Are they working with, as I mentioned earlier, are they working with experts in the field, doctors and neuro experts that they can reach out to and ask questions to if they have a problem or have a question. I'm in ongoing training. I'm in training 3 times a week. We will, one of us will show a map, and for an hour, 5 to 10 experts will look at this particular person's map and make suggestions, look at their history, look at what's going on, what's working, what's not working. Sometimes it's a matter of the specific parts of the brain not firing properly. Sometimes it's a matter of the connections between the brain. And we can see that when we get the information, we can see, is it making the connection well? Is that particular part of the brain low power or high power? Another thing that we can see are the connections, is it hyperconnected? So when I'm working with someone that's on the spectrum, and we do help people with autism, it's been really helpful with them. We're not trying to change their brain from being autistic. We're just trying to reduce their symptoms so their life's a little bit easier.
Mm.
But with autistic people, their brain is literally hyperconnected, and it's similar to a traffic jam. So imagine a street light where there's just too much traffic there, and the cars can't get through there. It's similar in the brain where there's too much connection happening, hyperconnection. The information can't get through the brain to do what it's intending to do. So we can work with that. We can slow that down a bit so that it's just easier life is just easier with the right chemistry in the brain.
So they just are basically sitting there and
Just sit in a chair.
and then
Yes.
you just observe what is happening and
Yeah. And, I will watch it for, it's interesting because many of my clients are hypersensitive or HSP. And they will actually relax a little bit when I step out. So I'll watch to make sure everything's working right. And I'll make sure that the protocol is effective. It's doing what I want it to do. I have one client who loves to cook, and she comes in and watches this session on barbecue, grilling. She just loves to come in and watch about grilling. And so, we'll hook her up. We'll talk about what's going on. I'll make sure it's working effectively. And then I'll set a timer and step out, and she just calms down. She's someone that her biggest issue is anxiety. So if she can just be in the room without me watching the equipment, and she's in her, she'll get a better session when I step out. Yeah, so they just come, they choose something to watch. We hook up the leads. They watch TV for 30 minutes, and then we unhook everything and they go home.
and do they feel better after the session generally, or
Sometimes people, it depends on what's going on with their brain and what we're asking it to do. Sometimes people have told me they feel a little tired, which is understandable because we are exercising the brain. We're expecting it, we're asking it to do something new. Sometimes they'll feel a little bit tired, and most of the time they don't notice a difference. And it will take 6 to 8 sessions before people really feel, yeah, this is different. I'm feeling a little different now.
Thank you.
So Cindy,
Anybody else?
could you explain those other 3 brain waves, the theta,
Bandwidths,
alpha,
yes.
beta?
Yeah, and that reminds me, there's another part of this that I want to share with you. So theta is just outside of sleep. So think of yourself as you're dropping off to sleep. You're probably in theta, and then you're unconscious. You're not aware of consciousness. Theta is just outside of sleep. Alpha is the part of our brain that is allocating resources. So it's the part of the brain that's deciding what the priority is, what part of the body gets which resources, which part of the body needs the highest attention. Is there injury somewhere, a cut somewhere? If alpha is high, it's likely that your thyroid is having some issues. the neurofeedback is a really good tool to kind of highlight if someone has thyroid issues. It also could mean that they have food allergies, or they have, it can also mean they're having stressful relationships, interactions. Maybe the child is having trouble with a teacher, or, you know, kids at school are teasing them. So it can indicate different issues of stress in a person's life. Beta is where we really want to be when we're trying to focus and learn and think clearly. We also test high beta. The reason we check for high beta is we want to get a sense of someone's tension. So if someone has got tension in their jaw, maybe they've got TMJ, or they just basically hold on to a lot of anxiety or tension in their body, that will show up in our reading. And we can help with managing, bringing beta down to a normal, balanced place for them. And so this process, you know, I mentioned it's easier with kids with younger brains. It takes a little longer depending on people's ages. I tell people, you know, if I'm working with someone who's 65, 75, I'll tell them it's taken you 75 years for your brain to be at this stage. So it's going to take us a while. It's going to take us a few months to get it balanced from where it's at right now. It depends, you know, if someone has had traumatic brain injury, depending on how serious, that can take a little bit longer because there's significant damage and we're rebuilding. We're doing a lot of work in the brain for that to be normal, or significant damage with stroke issues, or so it really depends on the situation.
So that same cap that you're using for diagnostics and to print out those things that you showed us, that's the same, that's also doing the treatment?
Oh, no, we only use this for the mind map. We
So
use
how do
that
you do
one
the
time.
treatment?
And then for the other treatments, we're just hooking up. So I'll show you some of the leads. So these are my leads. Can you see that?
Mm-hmm.
So I hook one end into an amplifier, and then I hook the other. I'll clip this on an ear, clip that on an ear. I'll put a ground lead just on your mastoid, just in the back, just behind your ear, just right on the bone. And then I'll put another lead. Like if I'm doing an SMR, I'm only doing one lead right in the scalp. So that's called a one lead session. I'll do one right on top, one on each ear, and then another right behind the ear right here. And then you're ready to go for a session. So it's a much simpler process. And that, when I've had people, most of my clients do home training, and we give them the software to add to their, put on their computer, and all of the training that they would need to figure out how to do this. You know, the first couple of times they're doing it, it's kind of awkward, and what am I doing, and how does this work? And then after 2 or 3 times, they're just like, clip, 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 what am I watching? And, you know, they're good to go. It just takes a couple of times of setting it up, and then they're like, yeah, I get it. It's not that complicated, really. Often parents, you know, moms will do it for children. They just need to hold still for half an hour watching some TV. So
I've got a question. So you said the one lead that's up at the top here. So I'm curious, what is that reading? It's taking a reading, and what is it reading?
It's reading what's happening at the CZ location, and we're reading delta, theta, alpha, beta, high beta.
everything.
We're reading all of it. Yep, we're reading all of it right there. And then with SMR, we're usually doing an eyes closed and we're training with auditory. So we'll have people choose something calming, you know, piano, relaxing piano music or something calming. And then they just listen to music for half an hour. And the training is happening to help the brain calm down. This again is where the brain can be retrained to not have seizures. So it's, you know, I mean, that's the extreme, right? If someone has high anxiety or highly sensitive people, we will always start them off with an SMR. We want to calm the brain down. There are some neurofeedback specialists who only do SMR. They only do this. And what's happened with their clients is once you're calming the brain down, it can heal other parts of the brain because this is calmed down and it can get back to normal. Okay, we need to work with temporal, you know, we need to work in this area, but now this is calmed down. We can do that. So I'm choosing to work from all the information I have because I want to help people both calm down the brain and focus on a specific issue, you know, help them focus better if they're having trouble with high delta. Let's bring that delta down so they can think more clearly and remember more effectively. So, yeah.
Does it help with old people remembering?
It can. It can. We are retraining, you know, we're rebuilding cells and connections. So if we get a mind map and we see slowing at locations that are responsible for memory and we normalize those are going to work better. So
Does it help dementia?
You know, I wish there was research that showed that we are helping dementia. I don't have that. I would guess that would be true, but I can't say I know that's true. I know that we're understanding now. I don't know if you've seen a bunch of the research. I get flooded with research coming across my desk every week. A lot of the research I'm seeing is connecting the gut biome with dementia. So there's a connection there. So, you know, if I see someone has got high alpha, they're having trouble with that allocation resource, and I send them to someone who's going to work on functional medicine, get the gut balanced. Will that help with dementia? Yeah, I think so, because there's that connection there. So it's a logical assumption that them finding out they're high alpha and going to a functional medicine person and then training alpha down and getting that working balanced and working properly could probably, but I can't say that I know that it does. I know that we can help. We cannot eliminate Parkinson's. We can't reverse it. We can slow it down. We can slow down how quickly it progresses. And I would always send anybody with Parkinson's to a functional medicine person. I know there's a lot of headway, a lot of progress being made with supplements for Parkinson's, and of course for balancing the gut biome. So, yeah. Any other questions?
What do you do for migraines?
We can help stop migraines. I have not worked with migraines specifically. I've talked with neurofeedback technicians who've had people come in with a migraine and stop it. So a migraine, my understanding of it is it's the brain hyperconnection and overstimulation. So I'm guessing it's an SMR protocol. What I would do is get a map get a sense of what's going on there. I want to, you're also unique. Every brain is unique. I want to know what's going on in your specific, in your brain at this age of your life, and, you know, decide what is a priority for you. So when I get a map, the information I get is sent to Georgia. Your mind map is information is sent to Georgia, and then I get back from Georgia, from the people that are experts, I get back protocols. And then I start running protocols based on what the experts see in your map and how they'd respond to it. And then as we progress, if I have questions or I'm confused by something's not working or whatever, I can make a phone call to someone and say, this is happening. They can jump on and look at the session. They can look at the map and make recommendations. And I can take a map into the training that I go into to have a group of experts looking at it. So yeah, we want to work with the whole body. You know, we want to know that people will work with us with healthy diet, getting the sleep they need. Exercise is great, and lots of water. It's really helpful.
Amy?
Oh, there's one more part I want to, I keep forgetting. So another part of this that was developed is a particular doctor, and I'm forgetting his name. He was one of the forerunners in developing this. He went to India and he did maps for on the brains of yogis who have been meditating for 30, 40 years. People that know how to get into that zone, that bliss through meditation. And he was asking the question, can we create a protocol that will help people do that quicker? And what they came up with is an Alpha Theta program. So most of my clients are coming in because they've got some kind of a physical issue, anxiety, depression, stroke, ADHD, whatever. Most of the people I see have those kinds of issues, but occasionally I'll get someone who is interested in Alpha Theta training. So we can do an Alpha Theta training, which is designed to get your brain chemistry into that zone. And people have I have not experienced this, and I have not had clients experience this, but I've had other technicians. There's results of people saying they had an afterlife experience or a profound experience that they might have from psilocybin or ayahuasca. So the Alpha Theta can get people into these amazing states, and it's also really healing to the brain. So it will heal whatever's going on in the brain. It's really calming and healing to the brain to do Alpha Theta sessions. And you can do an Alpha Theta session at home. Some of the protocols we're doing, some of what we're doing is coherence training. So if we see somebody has issues with coherence in the brain, we do a 4-channel protocol, and the home trainings will only do a 1 or a 2-channel protocol. But most of the protocols that people would need can be done at home if they are open to trying that.
So what does the coherence mean?
Coherence is, how do I explain? So if the trend line is like this, and then the next one is like that, we're looking at how those trend lines are responding to each other over time.
So those would be like trend lines of what?
Trend lines of alpha, theta, beta, delta. It's complicated to explain it. If I had a picture, I'd go pull it up for you. We're looking at several things. We're looking at coherence, we're looking at phase, we're looking at you know, is the brain spiking? We're looking at a lot of different things that can be good or bad, depending on a particular issue. We want to get the brain to a healthy coherence. So
I'm gonna change the view on this so that
Question?
we can see everybody. Okay, there.
okay. So gallery.
Yeah. So Paul has a question, I see.
Hi, Paul.
Hi. Do you have similar folks in the Spokane area that do what you do?
You know,
Yeah.
I would be surprised if there's not somebody there.
Okay. And then the second question, and we won't go into detail here, but if somebody wanted to make an appointment with you, how do they go about doing that?
If they Google clearmindvitality.com, they will go to my website and there's a book appointment button just at the top of it where they can get on a calendar, schedule a time with me. So just so you know, mind maps need to be done between 4 and 6 hours of waking.
Okay.
So whenever you wake up, we need our best case, healthiest mind map is within 4 to 6 hours of that waking time. So that'll happen in the morning. Schedule those in the morning.
Okay. Thank you.
Mm-hmm.
I put her website in the chat, and when I send out the recording, I'll have it in the email also. Amy, do you have a question? Unmute yourself.
All this ties into your brain map, whether I do it today or after my surgery, or, you know, depending on just where I am at the time, is your brain map, and it's going to be consistent with who you are and how you process.
Yes,
Or does it vary if I came in on another day?
yes, and so your brain map is a snapshot of what's happening in your brain in that moment in time. And your brain will have a consistent pattern through time. We would be able to see, okay, that's Amy, there's Amy again, that's Amy. That will be a consistent pattern. If we do neural feedback training and adjust it to improve coherence or give you a more balanced way of operating, that's something you keep, just like when a kid learns to ride a bicycle. The new skill that child learns is theirs for the rest of their life. So we do training and you get to keep that new skill set, you know, unless of course there's a car accident, you have brain injury that could affect it. Something that's interesting to me, you can have medication can cause a concussion. We're aware of now that some medications can be so traumatic to the brain, they cause a concussion experience or effect. And so some of the people I'm working with have had that happen to them, you know, through a surgery. So concussion can be falling. Well, I'm sorry. I'm sorry to say that to you just before you're going to.
I know.
Wrong timing. I'm sure you've got a really wonderful doctor who's going to be really careful with your surgery.
Anybody else have questions?
Any other questions?
How about sleep apnea?
Really good question. So I think my sense is we can, what I know is we can retrain the brain to sleep. the two clients that I've worked with that had apnea machines who did go through training continue to use their apnea machine. I'm not a doctor, so I would never recommend someone stop using something. Sometimes we will coordinate with doctors to reduce medication for people on ADHD, or, medications can be reduced with the help of your doctor once your symptomology is reduced with neurofeedback. So I don't know how to answer the sleep apnea thing. I don't think we really have a good sense of, we know how to help you sleep better. Does that help you get off the apnea machine? I'm not sure about that.
Okay. Billy?
What about high blood pressure?
Well, so high blood pressure is commonly associated with anxiety or high beta. We can help people to balance the brain and balance the high beta. I can't promise the blood pressure would come down, but
The anxiety might, huh?
the anxiety, yeah. And I suspect if the blood pressure, I suspect if your anxiety came down, your blood pressure would come down with it. I would want you to work with, or I want people to work with a functional medicine person to kind of see if there's anything in that realm that can support bringing the blood pressure down. Yeah. The anxiety, we're focusing on state, anxiety, depression. But yeah.
You mentioned when we were talking before, Cindy, that it's been being used for treating addiction also. Is that true?
Oh, yeah. Yeah. Yes. It's been used in many, many, many studies. One doctor used it with Native Americans with alcohol addiction and got a 78% success, I think, after a year. And that's unheard of, to have that high a number of people that are still sober. So what will happen with chronic use of alcohol or drugs, and I'm really glad you asked this, because I want more people to realize chronic use of medication or alcohol will change the brain. And we can help it come back to a normal state. And when we do that, people just don't want the alcohol as much. It's not as attractive. So with some vets that they were doing neurofeedback with, they stopped drinking. They were just like, they didn't want it anymore. I can tell really clearly with a map. When we see a map with someone is addicted to alcohol, it's called a low power fast map. And a map that is taken of someone who's used a lot of marijuana, we call a low power slow map. So, a lot of people are of the opinion that marijuana is not a big deal, doesn't really do anything. And, in occasional use, that I believe that's true. It's the same with alcohol. Now and then, occasional use, it's not a big deal, but chronic daily use will change the brain. So we see brains slow down in power and functionality from marijuana, and people just don't know about it. They just don't know that it's potentially affecting them in that way. But yeah, it's really effective with addiction. I wish some 28-day programs, many of them will have a neurofeedback component included with the getting sober program. So.
Ron?
Did you say you treated people with traumatic brain injury, like veterans or folks who had serious accidents of some kind?
Mm-hmm. I can see it's really fascinating to me. When I get a map, I can see if the brain has been injured, and I'll say, when did you hit the back of your head? Or it looks like the front of your head has been injured. And they'll say, oh, I fell off a horse when I was 10. Well, I can see that in a map, and we can work with that. The brain will compensate. So the back of the brain has a lot to do with visual and memory. And if that's injured, other parts of the brain will jump in and try to do what that was doing. But, it's just like if you have a team of 10 people and you lose 3 of them, those 7 people left cannot do the job as effectively as the 10 did. So helping to heal the brain where that injury happened is a real.
Does the Veterans Administration send you referrals for veterans, or?
They do not.
Okay.
It's a really sad situation with the VA. There have been 2 doctors who came across the research of neurofeedback, learned about it, became really excited about it, started doing research on it, got amazing results with vets using it. And then for some reason, the vet shut it down. And then another one came along, found the research, started doing research on it, got all kinds of people enrolled in it, got amazing results on the people he was working with. And again, it was shut down. So, we can speculate why. They know it works. They know it could be helping people. They're not using it. There might be small pockets of it happening here and there, but sadly, I don't know. I don't know why.
Does it matter how long ago the injury was? Like if it was somebody who was 10 years old, for example, you can still repair it?
We can still work with it. We can still work. The brain is, as you know, it's plastic. We can rebuild those connections. We can rebuild the neurons. If it's an older brain, it's going to happen slower than if it's a younger brain. So yes, and yeah, we can work to bring it back to a healthier place.
Wow. So do you have any stories for us?
Well,
some really unusual things that have happened, or especially amazing, or
I guess I've told you my favorites. As I mentioned earlier, I had a client who had a stroke, and when I was first working with him, his balance was so unsteady. He was using a cane and kind of leaning on the wall. And by the time we finished, he was volunteering to walk dogs at the animal shelter. So yeah, he made amazing progress, and I feel like his life is radically different because of the neurofeedback and getting back some of those abilities that the stroke impacted.
And how many sessions did that take? Just as a suggestion, an example.
He was in training for lots of months. So a long time with him. But
very cool. Paul?
Question. Where else in the world, what other countries are more amenable to the work that you're doing? and incorporate it into their healthcare systems?
What a good question. And I don't actually know the answer to that. I know that it's happening all over the world. When I'm involved in the training, I'm interacting with people from all over the world. Doctors, and there's many people that used to be work as psychologists or therapists, LCSW, that shifted to doing neurofeedback when they saw their clients getting better with it. So the brain can get stuck. Our brains can get stuck in a certain way of functioning, and therapy can try to help people work their way out of that, but the combination of therapy and neurofeedback is amazing because it just helps that become more flexible and open up its operation, its way of operating. So, a lot of people that were specifically just doing therapy, a lot of psychologists are now doing neurofeedback and shifted completely to just doing neurofeedback.
Thank you.
So it's happening. It is happening all over the world, and I'm not sure. I suspect it's happening in other countries more than here.
I would too.
Yeah.
I mean, just by the nature of our health system in this country.
Right.
I mean,
Yeah.
The dollar drives it.
Right. It's pretty much locked down. Yeah.
So this machine, oh, go ahead, Joye.
Okay, can you hear me?
Mhm.
Yes.
Okay, so I've been noticing a little more frequently, not really alarmingly so, but I kind of call it brain fog. What would you, how would what you do help that?
Did you have COVID?
No.
Okay, good for you. Many of the people that have had COVID are talking about brain fog. We can help clear that up and help the mind be more clear. How are you sleeping? How well do you sleep?
Pretty well. I mean, sometimes I have busy mind, before I can fall asleep, but for the most part, I sleep pretty well.
Sleeping good. Okay.
And it's not like, like I say, it's not alarming, but I just noticed that it does seem to, that's the only way I can kind of describe it,
Mhm.
I didn't know if it was age related, but it's just, that's the best way I can describe it.
Sometimes that can be diet related. There's a new book out by a psychiatrist, I think, that talks about the connection between diet and anxiety and depression. We know for sure there's a link between clarity of thinking and emotional states. So diet is affecting us much more than we realize. But yeah, we could with a survey to get a sense of if neurofeedback. I like to get the surveys done first and get a sense of if it's a good fit for people with whatever symptoms they want to reduce and what's going on with them. And then once we get the surveys done, and it seems like a good fit for you, we could get a map and get a clear picture of, is neurofeedback going to help with those symptoms or not?
Sure. Okay.
Get a picture of that. Yeah.
Thank you.
You're welcome.
What sessions cost?
So if somebody just wanted a tune-up, to kind of clear their foggy brain or their slow brain or whatever, or they're not remembering words and things like that. I mean, if they just wanted a tune-up to get wherever the best they could, is that something you do?
Oh yeah. Yeah. Well, because it's customized to your brain, because we're actually getting a map that is telling us exactly what is and is not working well in your brain. When we respond to that and look at what the priorities are, everything's working better. So we know that certain places are in charge of certain things, like temporal is predominantly in charge of emotional regulation, knowing what I'm feeling, responding to emotions and talking about it. All of that's happening here, remembering emotions. But it's all, the brain is working together. Even though there are certain locations that are doing certain things, it's all communicating together. And when that's not doing, when the communication for some reason is inhibited by the brain chemistry, the balance, we're working front to back and side to side to balance the brain. And when it's not balanced properly, it can't work as well. You know, so yes, can we do a tune-up? Yes, and it will be customized to your needs and your brain. Yeah. And I do sessions for myself because I do sessions for myself. I do sessions for my daughters. You know, I see the changes that are happening with my clients. I want to take care of my brain. I want to take my girls to have best possible experience for themselves. So, yeah.
Jenny?
Can I ask a question?
Sure.
So what would generally a session like the initial session cost?
So I have priced myself. I started out thinking I want to reach as many, I want to be affordable to families. So I got top of the line equipment. I'm working with a group of experts, and I chose to set up in my home, in a bedroom in my home, so that I can make the cost more affordable. So in my area, I had a client come in. She was seeing someone who was charging $1,500 for a mind map. $1,500. I charge $95 for a mind map. And the mind map will give you a sense of, is this a good fit for you? What's going on with your brain? And then we can decide, we can go from there. So, you know, if you just want to figure out, okay, what do you find? What's going on up there? You can just start out with get a mind map. Once you get a mind map, I sell neurofeedback in packages of 20 sessions. And 20 sessions is $1,900. And it'll take about 2 months to go through 20 sessions in office sessions. And that's if you're coming into my office. If you want to do home sessions, it starts at $1,000 a month to rent the equipment, but you can do a session every day. So you could honestly get 30 sessions in a month, or 3, 4, 5 sessions if you don't want to do it 7 days a week. You can significantly reduce the cost per session by renting. Now, if you have 2 people in your home that are doing neurofeedback, it's $1,000 for the first person and then $300 for the second. So you could get neurofeedback for 2 people for $1,300 per month. And that's with me monitoring, setting up protocols, adjusting protocols remotely. You know, you only have to come in the first time. We would get a map in the beginning to figure out where you're at, and then we get a map after. We could get one after 20. We typically get another map after 40 sessions, because we want to see, okay, what's different? What have we done? What do we still need to work on? What's a new priority? So we get another map every between 20 and 40 sessions. If I see a lot of change really quick, and what we're doing is we're checking off the protocols of your specific mind map. If they get checked off really quickly, we might need to get a map sooner, just to make sure that we're responding to where your map what your needs are. But typically, you could easily do 40 sessions before you have to get another map for a $95.
Thank you. That's so clear.
You're welcome. I am the best price in the area.
Are you in Vancouver?
I'm in Vancouver. Yeah. Yep.
I think I might get a map.
Okay, come on in. Let's do a map.
I mean, can't dance. I might as well get. Yeah.
Might as well get a map. Yeah, it's interesting to find out what's going on. Yeah.
Susan, did you have a question?
Yes. I was wondering, how long is your functional medicine doctor list? And I'm assuming it includes the Portland area.
It's not long enough. I need to add to that list. I have a handful of people that I like and send people to, but I want to add to that list because it can be an important part of. So if you know of somebody, if you can let me know of somebody that I could add to my list, I'd love to hear.
Okay, well, I go to a functional medicine doctor, but I don't know if she's interested, so I'd have to maybe ask her.
She might have enough clients.
And she's recently changed her practice to try to be able to help her patients more than she was able to in the past. So I don't know if there's, anyways, I'll ask.
Yeah, I'd love to have her name if she's interested in referrals.
Do you want me to email to it or tell you now?
Sure.
It's Dr. Borden.
Mm-hmm.
Say that one more time.
Warden, Worden, and she's located in Gladstone.
Funny.
I go to her.
Who?
Amy goes to her.
Oh, okay.
Okay. Thank you.
I was glad to hear you mention functional medicine doctor.
It's sad. It's sad to me that our healthcare system is so locked up by pharmaceuticals.
Yes. And I was looking for a naturopath, and just by a strange fluke,
You found her.
when I was getting a blood draw, the person knew of this doctor.
Okay. Awesome.
Yeah. So.
Any other questions or comments or Cindy? Well, thank you, Cindy. Really appreciate it.
My pleasure.
Very
It's been nice
interesting. Paul, did you have another question? Nope. Okay. All right. Well, I guess we'll just close down a little early. But thank you very much for coming, everybody. And thanks, Cindy. That was very interesting. I think I might get a map too.
You loved yourself.
Wonderful.
Yeah.
All right. Well, thank you, everybody. Take
Bye,
care.
everybody. Thank you.
You'll be hearing from me.
Oh, good. I look forward to seeing you.
I need help.
We all need help.
Get our brains tuned up.
Yeah.
Okay.
Bye, guys.
Bye. Thank you again, Cindy. That was great.